In this video, we're looking at 6 common dog behaviors that might seem harmless on the surface, but could actually be your dog's way of signaling an underlying disease. From ear infections to heart disease, these quiet signals can be the only clue you get before things get worse. Because when it comes to your dog's health, catching the signs early can make all the difference. So, let's jump into the first one. Number 1, they might have an ear infection. From my own experience, one of the first signs I noticed when my dog had an ear infection was that they would shake their head more than usual, paw at their ear, then sniff the paw they just used, or even start licking it. Ear infections are a common challenge for many dogs, especially breeds with long, floppy ears that trap moisture. But no matter the breed, any dog can be affected. These infections, often caused by bacteria or yeast, bring a deep discomfort that your dog doesn't know how to verbalize. So instead, they act, they shake, they rub, they whine. They hope you notice. It's easy to overlook or chalk it up to just a dog being fussy, but catching these early signals matters. Left untreated, an ear infection can lead to serious pain and even hearing damage. If it's your dog's first time showing symptoms and you're feeling unsure, the best thing to do is bring them to the vet for a proper checkup. With a timely visit, most ear infections are simple to treat, and recovery tends to be pretty quick. In my personal experience, treating this condition is actually quite manageable. The vet will usually prescribe ear drops, and your role is to gently clean your dog's ears and apply the drops a few times a day. Within just 1 to 2 weeks, their ears will likely be fully healed. If you're the kind of pet parent who wants to catch the little things before they become big problems, let your like be a signal to others to do the same. Number 2, they might have diabetes. When your dog suddenly begins drinking more water than usual and needs to pee more often, even in odd places or at unexpected times, it might feel confusing at first. You refill their water bowl again and again, thinking it's just a hot day or they're extra active. But their body could be struggling with something deeper: diabetes. Diabetes in dogs is more than a diagnosis. It's the body crying out for balance. As sugar builds up in the bloodstream, the body tries to flush it out through urine, and your dog keeps drinking to keep up with the loss. Yet, despite all this, they may still act hungry or start losing weight. That's because their body can't use the food they eat the way it should. It's not turning into fuel, it's slipping away, unused. This condition's becoming more common, especially in older, overweight dogs or certain breeds with genetic predispositions. Female dogs that haven't been spayed also face a higher risk. In the US, cases of canine diabetes have steadily increased in recent years, often linked to poor diets and lack of exercise. If you notice these changes in their daily routine, you should take them for a blood test so you can provide the right care in time. Number 3, they might have kidney disease. Of all the illnesses that can quietly take hold of our beloved dogs, kidney disease is one of the most difficult to spot early, and one of the most heartbreaking to witness. The symptoms can be subtle at first. Your dog might start drinking more water than usual, needing to pee more often, or perhaps having occasional accidents in the house. It's easy to chalk it up to aging or just a weird day. But as time goes on, the signs can become more obvious. Your dog might vomit, have diarrhea, lose interest in food, or start losing weight. Their eyes might look tired, and their movements may slow down. That's because the kidneys don't just handle waste. They play a role in blood pressure, bone health, energy levels, and even appetite. In more serious cases, dogs can suddenly go blind from high blood pressure or develop painful mouth ulcers. Some just seem weaker and more withdrawn. The causes are just as varied as the symptoms. Some dogs are born with a genetic predisposition. Others may develop kidney issues due to age, infections, toxins, or even long-term inflammation from something as seemingly unrelated as dental disease. And in many cases, it comes down to something as simple and often overlooked as diet. Dogs that eat primarily dry kibble but don't drink enough water are at higher risk. Kibble doesn't provide moisture, so if your dog isn't naturally inclined to stay hydrated, their kidneys can end up doing extra work over time. Number 4, they might have heart disease. When your dog starts slowing down, not just on walks, but even during playtime, it's easy to assume they're just getting older or a little tired. But sometimes that drop in energy is a quiet sign of heart disease. It often shows up subtly and can go unnoticed until it gets serious. You might spot early clues like a persistent cough, fast or heavy breathing, more naps than usual, or less interest in moving around. Some dogs may even choose to sit instead of lying down, simply because it's easier on their heart. And it's not just older dogs at risk. Heart disease can appear at any age due to birth defects, inherited conditions, or gradual changes over time. In small breeds like the Cavalier King Charles Spaniel or Chihuahua, it's often linked to mitral valve disease, where a faulty heart valve causes blood to flow the wrong way, forcing the heart to work overtime. In large breeds like Dobermans or Great Danes, the issue might be dilated cardiomyopathy, where the heart muscle becomes weak and stretched. The good news is, many heart conditions can be managed with medications, regular checkups, and tests like X-rays or echocardiograms. The outcome depends on how early the condition is caught and how well it responds to treatment. And when caught early, especially with mitral valve disease, many dogs can still enjoy long, happy lives. Number 5, they might have ringworm. If your dog keeps licking, chewing, or scratching the same spot again and again, and you're starting to notice red, bald patches, it might be more than just an itch. One common cause is a fungal skin infection called ringworm. It doesn't always make your dog itchy, which can make it easy to overlook, but the signs are still noticeable. Brittle fur, scabby or irritated skin, and even changes in the nails like cracking or breaking. Ringworm often shows up in circular patches where the hair falls out, sometimes growing back slowly from the center. And it spreads fast, not just on your dog's body, but around your home through fur, bedding, and anything they touch. What's tricky is that some dogs carry the fungus without showing any signs, which makes early detection even more important. If it's left untreated, ringworm can spread to other pets and even to people. That's why it's so important to catch it early and start treatment right away. A quick vet visit can confirm the infection and get you started on the right path to healing. From my own experience, ringworm is actually just as manageable as an ear infection. If your dog is unlucky enough to have multiple affected areas, your vet might recommend shaving the entire coat to make treatment easier. They'll likely provide you with a medicated shampoo, and after bathing, you'll need to rinse your dog with a diluted antiseptic solution as a final step. Once your dog is completely dry, continue applying a topical treatment, such as a spray prescribed by the vet. Number 6, they might have parvo. When your dog suddenly stops eating, it's easy to assume they're just being picky or having an off day. But if that loss of appetite comes with tiredness, vomiting, or a fever, especially in a young puppy, it could be something much more serious: parvovirus. Parvo is a fast-acting virus that attacks a dog's digestive system, leaving them too weak to eat or even move. You might notice your playful pup becoming unusually quiet, avoiding food, and seeming to be in pain. As the illness progresses, vomiting and bloody diarrhea often follow, and things can quickly become life-threatening. What makes parvo especially dangerous is how easily it spreads. It doesn't take direct contact with a sick dog. This virus can live for months on surfaces like the ground, your clothes, or even your dog's own fur and paws. And the best way to prevent parvo in the first place is through vaccination. Sometimes a skipped meal is more than just a quirk. It might be your dog's quiet cry for help. If even one of these signs helped you understand your dog a little better today, please give this video a like. It lets us know we're helping dogs and the people who love them. Share this video with someone else who adores their pup, because sometimes one small piece of knowledge can be life-changing. And if you want more simple, helpful tips to care for your furry friend, don't forget to subscribe. Your dog counts on you, and we're here to help you be the best you can be for them.